A new surgical procedure known as hot chemotherapy is helping treat patients with certain cancers in the abdomen. Dr. Raj Ramanathan is one of two oncologists at Banner MD Anderson Cancer Center who performed this operation. Doctor, good to have you here. Thanks for joining us.
Thank you, Ted. Thanks for the opportunity.
You betcha. This is called hot chemotherapy. Why is it called that?
Sure. It's part of a larger acronym, heated intraperitoneal chemotherapy.
All right.
It's a procedure that's been around for several years, but it's a procedure where we have more and more data that it can really help a select group of patients that have very advanced stages of cancer within their abdominal cavity.
Why is it abdominal cancer and not other cancers?
Sure. Our abdominal compartment is like a container that holds certain organs. And sometimes cancer cells can contaminate that whole abdominal cavity. And just the regular chemotherapy that one might get through their blood, it doesn't do as effective as a job as possible in that abdominal cavity. So this is usually done in conjunction with that IV chemotherapy to try and really clear up the cancer and the cancer cells in the abdominal cavity.
And that's where hot chemotherapy comes in. It's a two-step procedure, correct?
Exactly.
Describe it for us.
Sure. This is really for patients that might have a colon cancer, stomach cancer, ovary cancer, appendix cancer that ruptures inside their abdominal cavity and spreads the cancer cells around. So typically we see these patients after they've been through some chemotherapy already. And the two parts that you referred to, the first part involves removing any of the cancers that we can see or feel. And then the chemotherapy is there to really treat those floating cancer cells that aren't visible to the naked eye to try and prevent it from coming back again in the future.
So these, correct me if I'm wrong, heated chemo drugs, they're applied directly in there.
Correct, exactly. There's some specialized chemotherapy drugs that are heated at a higher temperature because then they work better. And we put that directly into a person's abdomen and let it circulate there for usually an hour to an hour and a half to try and maximize how many of the cancer cells we can kill and eliminate.
And I would imagine the lining of that cavity is where you really focus.
Exactly. It's the lining of the cavity and the lining of the organs within the cavity so that if those pesky cancer cells are attached to anything, we can hopefully kill them.
And again, explain why this would be a better option than traditional methods.
It's usually a conjunctive option, meaning that it's not usually IV chemotherapy or surgery, but it's just giving patients the opportunity to be considered for this in addition to IV chemotherapy. And it's important to also remember that this isn't experimental. This has been around for many years, but the one neat thing that we have to offer our patients now in Phoenix is this additional therapeutic option so that for these poor individuals that have this difficult cancer, they now have one more tool in their toolbox that we can use to fight their cancer.
If it's used in conjunction, does that mean that more chemotherapy, more chemo or drugs can be applied?
In general, yes. The job of this is to essentially try to bring the cancer burden back down so that they can continue to get more chemotherapy in the future and ultimately have a much longer life despite having a very advanced stage of cancer.
How do you know if you're a candidate for this?
You've got to come and see one of the physicians that performed this to get evaluated. Like you mentioned at Banner MD Anderson, we have two physicians across two different parts of the city. So Banner MD Anderson has 4 total facilities located in 4 parts of Phoenix. And at any of our locations, we would be happy to see a patient to see if they're a candidate for this great procedure.
And from your angle, from your perspective, how do you know that this person who came in, that's a candidate?
That's a great question. The way I think about it is, one, we want to have a cancer that responds to chemotherapy so we can use it. The second, we want to identify a cancer that's not so aggressive that the chemotherapy is not going to have a chance to work. And the third is we want to find somebody that has a relatively low enough burden of cancer to where we can feel confident that we can get it all out when we do the surgery.
That's an interesting point, because if you can't get it all, if the surgery doesn't get all of it out, I mean, does that candidate, do you proceed with this hot chemotherapy? Is that something you're going to have to wait?
No, typically we do a lot of different studies ahead of the big surgery, a combination of CT scans, and sometimes even just putting a camera in to look around before committing a person, because this is a big operation, Ted. These operations can take anywhere from 8 to sometimes even 20 hours. People are in the hospital for sometimes 7 to 14 days.
Wow.
So before we put somebody through it, we want to make sure that it's the right thing to do for them.
And if, let's say, someone gets put through it and it works, it's a good thing. Are there side effects? What do they experience afterwards?
Yeah, typically I tell everyone the initial recovery is tough. Usually those first 2 to 3 months, it's a bit of an uphill struggle with eating and activity. But usually by 6 months, universally, people are back to having a very normal quality of life. But these are all things that we go through. This isn't a decision that's taken easily or lightly, and it's a team approach that contributes to it.
And I asked you earlier why abdominal cancer was the focus here, but could this in the future, maybe in a more targeted or focused way, apply to other cancers?
Absolutely. So this similar concept has been applied in certain other centers to people that have diseases in their chest cavity, for example. So that does exist. But this therapy also dovetails with some of the other therapies we offer at Banner MD Anderson, including therapies such as immunotherapy, which boosts the body's own ability to fight cancer, targeted therapies, which look at certain mutations so we can very intelligently focus on cancers. So these are all part of a huge real panoply of options that can treat all of these.
And before we go, we're running out of time, but real quickly here, immunotherapy, I'm not hearing as much as I used to on that. Is that because it's now become standard practice in some degree?
Absolutely. Immunotherapy has had such wide penetration in medical practices. We've made huge strides with immunotherapy that I think it's become part of standard practice, but there's also exciting stuff ahead, specifically things called CAR T therapy. So we're continuing to innovate, and there's a lot more to come.
Yeah, we did a segment on that one too, not too long ago.
Wonderful.
Doctor, good to have you here. Good information.
Thank you.